Now Freud and then his followers sort of created a kind of a dynamic classification of emotional and psychosomatic disorders, linking them to disturbances in the different stages of the libidinal development. This is a scheme that was put together by Carl Abraham, all the observations from the early psychoanalysis. Now, according to Carl Abraham, even psychotic disturbances can be understood psychologically, and they represent fixation and then regression to very early period of libidinal development. Carl Abraham differentiated within the oral zone the passive oral zone, which is associated with the period of sucking, and then the active oral period, which coincides with teething and biting. According to this scheme, a person who is schizophrenic would have a history of very severe disturbances extremely early in the oral stage, in the passive oral stage, so that when the person runs into difficulties, he or she regresses all the way to the earliest stage of development. At the time, because there is some serious dissatisfaction in relation to the mother, there would be sort of perception of the maternal organism as being essentially hostile. This can, for example, lead to delusions concerning something like an influencing machine. Many of the schizophrenic patients feel under some kind of noxious influence of the machine or some kind of other external factor. And in Abraham's scheme, this would be then interpreted as feelings that originally were addressed to the maternal body, to the body of the nursing mother. The active oral period would then, according to the scheme, be associated with manic depressive disorders. The idea here is that there is a hostility that is oriented towards the nursing mother, and that hostility is then introjected, is sort of turned inside, so that, for example, something like suicide in this kind of thinking would be interpreted as killing of the introjected object, something that originally was hostility towards something outside that became then part of the individual. Two additional disorders that would be associated in this scheme with the oral zone would be then alcoholism and addiction, which would be linked to oral frustration. When the primary disturbance happens at the time of the toilet training that focuses on the anal zone, it would create a disposition to another kind of disorder, which would be the obsessive-compulsive neurosis, where the patient is basically tortured by returning recurrent kind of ideas which themselves are irrational, but the patient cannot get rid of them, and also by compulsions to do something, some irrational behavior, ritualistic behavior that does not make any sense. Now this, according to the psychoanalytic scheme, would be considered to be a result of a regression back to the anal period, kind of a pressure of the anal impulses that become unacceptable because of the superego, because of the conscience of the patient, and the obsessive-compulsive symptoms occur then as a result of the conflict between these two forces, as a compromise between the instinctual drive and the defense mechanism that is trying to suppress it. In a very similar way, the urethral stage would then create a disposition, if there are any problems, frustration and so on, overindulgence would create disposition for pathological ambition, feelings of inferiority, fear of blunder, and a tendency to overcompensate it into excessive ambition and perfectionism. And then some major disturbance happens in the phallic stage, which is around the age of 4, when another very important dynamic is occurring, which is something that Freud called the Oedipus and the Electra complex. The Oedipus complex is a little boy's hostile attitude towards the father as a rival and affection for the mother, and the Electra complex is the mirror image for a little girl which is hostility towards the mother figure, and feelings of love towards the father figure. Now, if there is a major problem here, a fixation on this stage, then regression during the time of some difficulties will then create symptoms of hysteria, which in traditional psychoanalysis has two forms. The first one is anxiety hysteria, which primarily manifests as pathological fears, as phobias. And the other form of hysteria is called conversion hysteria, where the psychological conflicts are expressed in physical language. So this would involve symptoms like hysterical blindness, hysterical loss of the voice, it's called aphonia, hysterical paralysis of the arms or the legs, hysterical pregnancy, or so-called hysterical seizure, where the person would be lying on the floor doing a lot of stylized movements, very theatrical, frequently with kind of a sexual undertone, and usually it's kind of laughing and crying at the same time. So these are the main examples of the early Freudian approach to the understanding of emotion and psychosomatic disorders. Now, what is characteristic for all these interpretations is that they are limited to postnatal biography and to the individual unconscious, as Freud described it. The idea here is that the newborn is what Freud called tabula rasa, which means clean slate. The newborn is like a virginal terrain, and what that child becomes depends on the relationship with the mother, father, the siblings, the different psychosexual traumas, the dynamics in the family, and so on. Later development in psychoanalysis, which led to ego psychology, basically didn't change anything on this fundamental fact that everything is being interpreted from postnatal event if we are dealing with psychologically determined disorders, because this doesn't apply to biologically or organically determined disorders. So the ego psychology then put a lot of emphasis on object relations and sort of refine the understanding of the interaction within the family and so on, the development of object relationships.